Okay, let's take a look at case 2. We're looking at first aid cases for the USMLE Step 1, 3rd edition. Case 2. A 65-year-old man presents to his cardiologist for evaluation of recurrent episodes of lightheadedness, chest pain, and shortness of breath with exertion. 1 week earlier, he experienced an episode of syncope while walking up the stairs to his house. Doppler echocardiography demonstrates a heavily calcified aortic valve with calculated valve area that is 40% its normal size. Echocardiogram is shown in figure -2, which you can't see. What is the most likely diagnosis? Aortic stenosis. What factors increase the risk of this condition? Aortic stenosis is commonly associated with older age, male gender, hypercholesterolemia, rheumatic fever, and congenital bicuspid aortic valve. What type of murmur is caused by this condition? The murmur of aortic stenosis is a systolic ejection murmur at the right upper sternal border, radiating to the neck. Signs of a severely stenosed valve include peaking of the murmur late in systole, palpable delay of the carotid upstroke, soft second heart sound, and an S4 gallop. How is this condition associated with congestive heart failure? Aortic stenosis implies narrowing of the aortic valve, causing resistance to outflow of blood. In severe stenosis, valve area of less than 50% of normal size, the narrowed valve causes increased pressure to build up in the left ventricle, leading to concentric left ventricular hypertrophy, or LVH. Although the left ventricle initially responds to the increased pressure by thickening its walls, the increased wall stress eventually decreases left ventricular function, leading to CHF. Left ventricular hypertension also compromises coronary blood flow during exertion and can lead to angina. What complications are associated with this condition? Angina. Without intervention, 50% of patients with angina die within 5 years. Syncope with effort. 50% of patients die with 3 years. That's syncope with effort. Dyspnea on exertion. 50% of patients die within 2 years. Post-stenotic aortic dilation. Dilation of aortic root due to high pressure flow through the narrow valve increases the risk of aortic dissection. What is the appropriate treatment for this condition? Valve replacement is recommended in placements with symptomatic severe aortic stenosis, as 10-year survival rates after replacement are comparable with those of the normal population. Mechanical intervention, such as balloon valvotomy, provides only temporary symptomatic relief for patients with calcified valves and others not and offers no survival benefit. Sodium restriction and cautious use of diuretics may be indicated in the setting of CHF. Excessive volume depletion should be avoided to prevent hypertension.